I am going to begin reading Chapter 1 from I Hate You, Don't Leave Me, The World of the Borderline. And here's an excerpt from Eugenia O'Neill's book, A Long Day's Journey into Night. Everything looked and sounded unreal. Nothing was what it was. That's what I wanted, to be alone with myself in another world where truth is untrue and life can hide from itself. Dr. White thought it would all be relatively straightforward. Over the 5 years he had been treating Jennifer, she had few medical problems. Her stomach complaints were probably due to gastritis, he thought, so he treated her with antacids. But when her stomach pains became more intense, despite treatment and routine testing proved normal, Dr. White admitted Jennifer to the hospital. After a thorough medical workup, Dr. White inquired about stresses Jennifer might be experiencing at work and at home. She readily acknowledged that her job as a personal manager for a major corporation was very pressured, but as she put it, many people have pressure jobs. She also revealed that her home life was more hectic recently. She was trying to cope with her husband's busy legal practice while tending to the responsibilities of being a mother. But she doubted the connection of these factors to her stomach pains. When Dr. White recommended that Jennifer seek psychiatric consultation, initially she resisted. It was only after her discomfort turned into stabs of pain that she reluctantly agreed to see a psychiatrist, Dr. Gray. They met a few days later. Jennifer was an attractive blonde woman who appeared younger than her 28 years. She lay in bed in a hospital room that had been transformed from an anonymous cubicle into a personalized lair. A stuffed animal sat next to her in bed, and another lay on the nightstand beside several pictures of her husband and son. Get well cards were meticulously displayed in a line along the windowsill, flanked by flower arrangements. At first, Jennifer was very formal, answering all of Dr. Gray's questions with great seriousness. Then she joked about how her job was driving me to see a shrink. The longer she talked, the sadder she looked. Her voice became less authoritative and more childlike. She told him how a job promotion was exacting more demands, duties about which she felt unsure. Her 5-year-old son was starting school, which was proving to be a difficult separation for both of them. Conflicts with Alan, her husband, were increasing. She described rapid mood swings and trouble sleeping. Her appetite had steadily decreased, and she was losing weight. Her concentration, energy, and sex drive had all diminished. Dr. Gray recommended a trial of antidepressants medications which improved her gastric symptoms and seemed to normalize her sleeping patterns. In a few days, she was ready for discharge and agreed to continue outpatient therapy. Over the following weeks, Jennifer talked more about her upbringing. Reared in a small town, she was the daughter of a prominent businessman and his socialite wife. Her father, an elder in the local church, demanded perfection from his daughter and her 2 older brothers, constantly reminding the children that the community scrutinized their behavior. Jennifer's grades, her behavior, even her thoughts were never quite good enough. She feared her father, yet constantly and unsuccessfully sought his approval. Her mother remained passive and detached. Her parents evaluated her friends, often deeming them unacceptable. As a result, she had few friends and even fewer dates. Jennifer described her roller coaster emotions, which seemed to have worsened when she started college. She began drinking for the first time, sometimes to excess. Without warning, she would feel lonely and depressed, and then high with happiness and love. On occasion, she would burst out in rage against her friends, fits of anger that she had somehow managed to suppress as a child. It was about this time that she also began to appreciate the attention of men, something she had previously always avoided. Though she enjoyed being desired, she always felt she was fooling or tricking them somehow. After she began dating a man, she would sabotage the relationship by stirring up a conflict. She met Alan as he was completing his law studies. He pursued her relentlessly and refused to be driven away when she tried to back off. He liked to choose her clothes and advise her on how to walk, how to talk, and how to eat nutritiously. He insisted she accompany him to the gym where he frequently worked out. Alan gave me an identity, she explained. He advised her on how to interact with other lawyers, when to be aggressive, when to be demure. She developed a cast of players whom she could call on stage on cue. They married at Alan's insistence before the end of her junior year. She quit school and began working as a receptionist, but her employer recognized her intelligence and promoted her to more responsible jobs. At home, however, things began to sour. Alan's career and his interest in bodybuilding caused him to spend more time away from home, which Jennifer hated. Sometimes she would start fights just to keep him home a little longer. Occasionally, she provoked him into hitting her. Afterwards, she would invite him to make love to her. Jennifer had few friends. She devalued women as gossipy and uninteresting. She hoped that Scott's birth, coming 2 years after her marriage, would provide the comfort she lacked. She felt her son would always love her and always be there for her, but the demands of an infant were overwhelming, and after a while Jennifer decided to return to work. Despite frequent praise and success at work, Jennifer continued to feel insecure and she was faking it. She became sexually involved with a coworker who was almost 40 years her senior. Usually I'm okay, she told Dr. Gray, but there's another side that takes over and controls me. I'm a good mother, but my other side makes me a whore. It makes me act crazy. Jennifer continued to deride herself, particularly when alone. During times of solitude, she would feel abandoned, which she attributed to her own unworthiness. Anxiety would threaten to overwhelm her unless she found some kind of release. Sometimes she'd indulge in eating binges, once consuming an entire bowl of cookie batter. She would spend long hours gazing at pictures of her son and husband, trying to keep them alive in my brain, she says. Jennifer's physical appearance at her therapy sessions fluctuated dramatically. When coming directly from work, she would dress in a business suit that eluded maturity and sophistication. But on days off, she showed up in short pants and knee socks with her hair in braids, and at these appointments she acted like a little girl with a very high-pitched voice and limited vocabulary. Sometimes she would transform right before Dr. Gray's eyes. She would be insightful and intelligent, working collaboratively toward greater self-understanding, and then become a child, coquettish and seductive, pronouncing herself incapable of functioning in the adult world. She could be charming and or manipulative and hostile. She could storm out of one session, vowing never to return, and at the next session cower with the fear that Dr. Gray would refuse to see her again. Jennifer felt like a child clad in the armor of an adult. She was perplexed at the respect she received from other adults. She expected them to see through her disguise at any moment, revealing her as an emperor with no clothes. She needed someone to love her and protect her from the world. She desperately sought closeness, but when someone came too close, she ran. Jennifer is afflicted with borderline personality disorder. She is not alone. Recent studies estimate that 10 million or more Americans may be afflicted with BPD. Between 15 and 25% of all patients seeking psychiatric care are diagnosed with this disorder, and it is by far the most common of all personality disorders. Yet, despite its prevalence, BPD remains virtually unknown to the general public. Ask the man on the street about anxiety, depression, or alcoholism, and he would probably be able to provide a sketchy, if not technically accurate, description of the illness. Ask him to define borderline personality disorder, and he would probably give you a blank stare. For more than a decade, BPD has been lurking as a kind of third world of mental illness, indistinct, massive, and vaguely threatening. BPD has been underpublicized partly because of the diagnosis is so new. For years, borderline was used as a catch-all category for patients who did not fit more established diagnoses. People described as borderline seemed more ill than neurotics, who experienced severe anxiety secondary to emotional conflict, yet less ill than psychotics, whose detachment from reality makes normal functioning impossible. The disorder appeared to coexist with and border on other mental illnesses: hysteria, manic depressive disorder, schizophrenia, hypochondriasis, multiple personality disorder, sociopathy, alcoholism, eating disorders, phobias, and obsessive compulsive disorders. Psychiatrists could not seem to agree on the separate existence of the syndrome, much less on the specific symptoms necessary for diagnosis. Even today, studies corroborate that about 90% of patients with BPD diagnosis also share at least one other psychiatric diagnosis. In many ways, the borderline syndrome has been to psychiatry what the virus is to general medicine, an inexact term for vague but pernicious illness that is frustrating to treat, difficult to define, and impossible for the doctor to explain adequately to his patient. Though the term borderline was first coined in the 1930s, the condition was not clearly defined until the 1970s. As more and more people began to seek therapy for a unique set of life problems, the parameters of the disorder crystallized. In 1980, borderline personality disorder was included in the American Psychiatric Association's third edition of the Diagnostic and Statistical Manual, the Diagnostic Bible of the Psychiatric Profession. The revised DSM, published in 1987, further refines the diagnosis. Though various schools within psychiatry still quarrel over the exact nature, cause, and treatment of BPD, the disorder is officially recognized as a major mental health problem in America today.